unfortunate part of healthcare as a business is that we all should be looking for the best outcome, but it is a business in a sense, right? So you're competing against the academic medical center, against the large IDN. It's still a very competitive market. Where if we could, I think it has to be a governing body. It has to be a reimbursement. It has to be coming up Medicare or some type of value-based care incentive. There's all these different variables to drive incentives in healthcare. And because we're not a universal health system, we're not like England, we're not like Canada or other universal systems, it hasn't worked in the past. So how do we create something that's almost like a meaningful use, but for data sharing, data collaboration across the stakeholders, whether that be life sciences, whether that be the providers, whether that be the payers, right?
Hello, everyone, and welcome to the Business of Learning podcast. My name is Joao Camargo, and my guest here today is John Elliott, who is the head of growth at MDClone. John, thank you so much for being here today. I'm really, really excited for us to have this conversation.
Great. Thanks for having me.
Why don't we start off with the same way that I start every single one of these talks after 150 of them, which is just you telling the listener a little bit more about yourself, a little bit more about MDClone, who you guys are, who you help, and any further context that you want to share about the company.
Sure. I'm John Elliott. I come from a career really grounded in healthcare technology sales, starting with big public companies, Cerner, now Oracle. So really got my introduction into healthcare technology, going through their client rep program, really great shadowing program, really understanding healthcare acumen, taking sales. I had some sales expertise and experience, but then bringing that into healthcare, understanding the sales process for health systems, really working and shadowing under some of the lead executives under Cerner. It was a great foundation for my career. And then transitioned into oncology, specifically in oncology, more of a venture-based startup called CareVive, was focused on electronic patient-reported outcomes, and really got to understand oncology. I think oncology, that was an intentional move just because the complexities of oncology really capture all the stakeholders in healthcare. So got to better understand life sciences, payer, different reimbursement models with value-based care in the oncology space. And then now I'm at MDClone, serving a similar role in that I lead our sales organization, sales and marketing, as head of growth.
Awesome. Amazing. And tell us a little bit more about MDClone, who you guys are helping, a little bit more about the company, further context for everyone that's listening in. That's okay. Well, I get the MD part. What about the clone part? Well, how does that all tie together?
Sure. So MDClone, think of it as the full spectrum from a healthcare data perspective, right? So it's a fairly segmented market when you think of, what data insights. Lots of companies use the phrase data insights, and achieving the value of data. Some are services companies, some are platforms, some are more complex than others. Some offer a suite of solutions. We really strive, and when we help our partners, and you hear firsthand from our partners, is that we really help them everything from implementing and driving everything from data governance that every organization has, but some are a lot more, they execute on it, a lot more people and process. We help them provide a platform that's people, process, and technology, and we really bring the value from the subject matter experts, the clinicians. So that MD part is really about self-service clinicians, giving them access, driving volume, helping with that curiosity, an intuitive platform enabling them to ask questions. Right, where traditionally they maybe go to analytics, they log a ticket, right? They have a hunch around a patient population. They have to request a small nugget of information to run a query on. It leads to another question and another, and it's a pretty rigorous, cumbersome, long process that rarely achieves a lot of value, which means a lot of people never even start the process. So we're really about volume and value, and it's really like speed is what is enabling both the value and volume. So I can go in as a physician and I can query something specific to the population that I'm focused on. Say I'm a neurologist, or say I'm emergency medicine. And then so you have subject matter experts driving business cases within their patient population that then also provides that's kind of more of the end user on the clinician side, kind of more the MD part of it. But then the value to the system is really having this objective framework where business cases are coming from the subject matter experts with data supporting these questions, right? The curious, and where they believe there may be an opportunity for improvement, or improving patient outcomes, improving operational efficiencies, reduction in costs around, think of it as a full rounded opportunity to see a full rounded business case.
Mm-hmm.
It's objective because it's in a framework, right? It's not necessarily the service line with the most analysts that present the best business case that then gets approved, right?
Mm-hmm.
So then from an executive side, we're able to provide this objective framework for leadership, whether it's head of quality or chief medical officer, CMIO, CEO, CFO, where these decisions are being made around where do we invest, how do we improve, and both from patient outcomes and financially, where are there opportunities that are really driven or identified by the subject matter experts, data supporting them, and it's objective across all the service lines. So
Awesome.
it's kind of brings a data democratization to the whole organization and embraces a whole data-driven culture.
Yeah.
So yeah, it's a lot. I tried to cover all the pieces there,
Oh, that's really
um,
helpful. Yeah.
but and we could go into any of those and much deeper. And a lot of that comes to I can't forget this, our core competency and where we started a long time ago, and kind of going with the cloning component of MDClone is around synthetic data in healthcare. And there's a lot of use cases. There have been traditionally more in the research space and more in the kind of those population health or even public health spaces like the VA. We support the VA.
Mm-hmm.
But now in this evolution in the AI era, um, there's many more use cases for synthetic data and training AI agents. And
Mm-hmm.
that's kind of some of our future and where we have a lot of traction today with health systems.
Yeah, no, that's awesome. And I would love to dive into AI a little bit later as well. But it's cool to understand because you guys are giving the frameworks, the systems, the processes. But on top of that is that data clarity. And I think there's so much um, data overwhelm in businesses now. Like there's so many things that they can use, but they don't actually know how to understand that in the right way. And then also apply that on through their processes, through their frameworks to optimize their procedures, their finances, their patient outcome, whatever it might be. And you guys are making sure, like, I don't know, we're not just like putting all this paper ball of information together and throwing it out the door. It's like, no. We're making sure everything is as organized as possible so that there is that clarity. And then there's that the functionality side of things as well, if that's correct.
Yeah. Yeah,
I mean,
you got it.
good stuff. And then tell me a little bit more about the AI side of things as well. How have you guys been able to implement it internally to assist that entire process and allow it to be a much more seamless, frictionless operation on I guess the team internally for you guys as well, but also for the clients you work with?
Yeah. So, everybody needs to be relevant in this AI revolution. And if you're not incorporating AI, whether it's in your own processes, your own operational portions of your business or your products, or even know how you fall in this ecosystem, then you've already fallen behind, right?
Yeah.
And it's moving very quickly. So, we've incorporated several different ways. So, gosh, going back even 2 years ago, we started developing kind of in the very beginning of these kind of co-pilot models that we've seen now out in the space. So we've incorporated similar capabilities for helping end users, so those clinicians who aren't statisticians, who aren't necessarily informaticists, and are not the biomedical informaticists. They're a physician, they're a
Mhm.
practicing physician. So helping them ask the right questions and create a dialogue with the data. So we're utilizing, and we have what we call them Atom as part of our Atoms platform. So
Mhm.
ask, discover, act, and measure and
Mhm.
share is really our core product. That again, foundationally, synthetic data is supporting, but the AI component of it is helping them ask better questions. So
Mhm.
if you think of it, even using whether I'm using Gronk or Gemini or whatever I'm using for my personal AI
Yeah.
efficiencies, think of it as applying something a logic like that or a chat capability like that to create a dialogue on asking questions around the data. So, for
Mhm.
example, I have a hunch around a length of stay for a specific patient population. We're going to help you ask the question. We come back and say, well, the AI can identify maybe what the root cause is. You may not be asking the question to really that it would have identified the root cause from more of like a statistical from like a query perspective. You may not have asked it that way, but they may say, here's really the outlier here. So
Mhm.
I give the example. I'm a type 1 diabetic. I often give that's also a tie of mine to why I'm in healthcare technology.
Okay.
But I often give this example, say like a diabetic population, you're looking at an A1C, which is essentially the average blood glucose over about a 90-day range. And you say, hey, what's the difference of the average A1C here and here and admissions in the ED and what was you throw in another variable or two. But they never pulled in or they never identified or thought of some other variable, right? That
Mhm.
variable that they didn't include in the question, the AI may help you say, well, what's interesting is the outlier is really that this population has an A1C all over 9, and these also all have recent visits to cardiology, right?
Mhm.
So
That's
that's not uncommon, right? Diabetes and cardiology, there's heart issues, right? There's lots of other comorbidities that happen, but the physician was maybe just looking at length of stay based on an admissions through the ED for diabetic patients and realized that there was this trend related with some cardiac procedure. And then then it creates a conversation around maybe the cardiologist and the endocrinologist that's trying to better understand this population and maybe the
Mhm.
care they're providing or how they get ahead of something, so they can ultimately improve the outcome,
Mhm. Whereas
right?
before they would have been probably separate.
Exactly,
Mhm.
right?
Mhm.
Because kind of in medicine, you got to think. I over my career, I've seen where working with physicians, whether they're in their practicing everyday role or they're administrators, they go through med school, right? They want to, and they're very focused. They specialize. It's a science, right? And it's a controlled science. You have fixed variables, and you get to solving or a diagnosis, and then you go through the treatment pathway or treatment plan, right? So if you can help them, sometimes they'll go too far down one path, and the data, you know, tells them about this variable over here that wasn't maybe the first thing they thought of, or the second, or the fifth, or ever would have thought of. And that's what we're trying to connect with some of the AI capabilities that are happening on the back end, driving this dialogue.
That's really, really cool. Thank you for sharing that as well. It's so cool. I think so many businesses that I've spoken with, and you'd be surprised, out of now over probably 250, I would say, and this is not based on any real statistical data, but just from me remembering the conversations, I would say like 80% of them, the majority or the extent of their understanding or implementation of AI is just like ChatGPT, Claude, and like that's it. And then there's so much more. That's like the tip of the tip of the tip of the iceberg. And then there's so much more that can be implemented, such as some of the use cases that you just shared. So it's really, really cool when I'm speaking with a company that is implementing these things and is trying to improve their processes and is doing their best to innovate and do it in the right way. That is, of course, going to increase the impact overall for the organization as well. And I'd love to
Yeah.
understand too, despite, sorry, not despite, but as you guys are using it internally, are you also using it externally when you're looking at business growth, possibly acquiring new clients, all those things as well? Is that something that you guys are implementing or just on the internal side of things?
Absolutely. I mean, when we think from an ops perspective, and I think of just the team that I work closest with, so marketing, sales, alignment, and we're looking at, what are the problems we're solving and who's the ideal customer profile and how do we engage them? I mean, on the sales operations, marketing, sales alignment side, there's a ton of tools. One that I just was listening to and I have my team doing some research on is called Lindy. It's like connecting all the dots. So how do you connect the CRM with
Yep,
with
yep,
with the contact list, with the how do you do the follow up? How do you automatically prompt a follow up? So the efficiencies are huge,
yep.
and it does take a skill set to really understand how to connect all the dots. But the technology, the back end, is there to do it, right? So I'm trying to help. I have a dedicated resource on the team that he's tasked with trying to stay on the leading edge of what's possible, and
Mhm.
is works the closest with our all of our sales operations tools, whether it's Salesforce or it's HubSpot or it's Zoom Info or Seamless AI and all these pieces you have in your sales ops and marketing tech stack. How can we work with someone like a Lindy to automate so much of this without losing? I am old school in sales and saying without losing that like humanizing the
Yes,
message,
yes.
right? Like and that personalization. Um, the AI can help with personalization, but it's a fine line because you
Mhm.
you don't want to come off as an agent, right?
Yeah.
Um, so anyway, that's a fine line. And just one other thing, I don't know if it's
Sure.
directly to that question or actually maybe in the last question is in the AI space, I've referenced synthetic data and said it's a core competency and really where we started in the research space. There's a whole nother use case now in how health systems can utilize synthetic data, not just for research and from like a data sharing collaboration perspective, but from a testing and AI environment. So
Mhm, mhm.
one of the biggest
Before you
barriers.
there, John, just very quickly, tell everyone about the importance of synthetic data as well and how it applies to what you're about to share with us too.
Sure. So, you know, synthetic data is not a new thing. It's been around. There's been plenty of folks who objected to say, it doesn't correlate the same. But on the flip side, there's been a lot of research that has been done that says that it, statistically reacts exactly the same
Mm.
as the original data set. And it's by changing. I'm not going to do a great job of articulating the difference,
Okay.
exactly. But think of it as in healthcare, it's particularly useful because of the security of the data.
Mhm,
So
mhm.
it's one thing when, Elon Musk says we need synthetic data to train for autonomous driving, right? And we need to, and they're making up, they're synthesizing data to create, lines on the road and stop signs and pedestrians and bicycles and all the things that are relevant to
Yeah,
autonomous driving. Well, that data is not secure, right? It's okay to just create it, right? And
yeah.
it's okay. So, but in healthcare, um, we have all these components around PHI and data security and which are all extremely important, right? So it takes synthetic data to there's a whole nother use case of, well, if I can take an original data set and I can synthesize it, and everything then becomes secure, and of course it responds, reacts, and has the exact same correlations as an original data set. That's huge, because now not only for research where you say, hey, I want to share this, right? To have more of a collaborative, research utility
Mhm,
use case
mhm.
for a data set. Think of this for training AI.
Yeah,
Yeah.
yeah.
So that's the big piece, is that volume of data for testing has been a thing for a while.
Mhm.
You bring it to healthcare, you add the PHI component, it's that much more important. And then you have it. And that was even before. Um, that was before AI. Now you have AI that's so fast, but it's so much more dangerous.
Mm.
When you say, it's one thing to say, hey, I don't know, there's an AI agent for about everything in every industry now. But in healthcare, if you were to say now it's trying to calculate throughput in a specific service line or bed in an acute care space, and it can look at all the variables, all the diagnosis, all the staffing ratios. It can look at every variable like so quick,
Mhm.
and give you a pretty good output. Um, but the data that it's looking at it needs to be secure.
Yeah.
And you can't say, how do you then go test and say, trust the new developer, the startup that says, hey, my tool can do this, and they show an example on a sandbox environment with some hypothetical data, and you say, that's great, but I really got to know how it applies to us, because
Mhm.
my patient population is unique, my payer mix is unique, my staffing ratio, you need your data to really test it, because there's no margin for error in healthcare when you're using some of these agents.
Mhm.
So being able to simply synthesize your own data to train the agent
Yeah.
that's a one one new use case. There's many others as we look at synthetic data in the AI space.
Awesome. Yeah, that's really, really cool. Thank you for sharing that as well. And I'm wondering, just looking at a growth perspective now, even for MDClone itself, as you're looking over a lot of the team that's taking care of that side of the company, one thing that I always like to highlight in this podcast is that businesses are not just sunshines and rainbows, as some people might um, presume. So, when looking at the growth targets that you have, looking at the things that you guys want to achieve, let's say you had a magic wand, John, and you could just wave this phenomenal, amazing magic wand to solve one obstacle, one challenge that would allow you to hit your revenue goals, your sales goals, the client acquisition targets, whatever those might be. You wave that wand, one thing out of the many that you're focusing on gets solved. What do you want to solve?
That's a good question. You see this on the attempts. I mean, even just today, I don't make this too time sensitive, but we're in late July right now. And if you look at some of the Becker's articles and talking about how the White House is pushing for um, data sharing and really interoperability.
Mm,
Previously we had in healthcare technology, we had meaningful use, and there were huge incentives and penalties, and there was a call to action, right? And there was a tremendous amount of funding that drove that change. And there was many benefits around that, right? Around HIPAA, the digitization, we've done that now. There's scrutiny saying, okay, we've digitized it. Are we really getting the value, right? So now we've moved into this data era. And I think it hasn't proven out, or maybe we haven't seen, if we were to look at health outcomes in the United States, it's unfortunately, or given our spending, like it doesn't, it's broken, right? And everybody would say that. Now the answer is really tough, but I think the first step, and if I had the wand, would be for there to be uh, governance in place or another type of incentive that says we talked about the High Tech Act and there's interoperability and there was this push for we need to utilize and standardize on HL7 and call it FHIR and that was a push, right?
Mm-hmm.
But it still hasn't gotten the impact that we need. So really how do we share and collaborate data securely to really get like this network effect and really get the economy of scale that each system is kind of independently doing and they're competing against each other,
Mm-hmm. Mm-hmm.
which, this is the unfortunate part of healthcare as a business is that, we all should be looking for the best outcome. But it is a business in a sense, right?
Mm.
So you're competing against the academic medical center, against the large IDN.
Yeah.
It's still a very competitive market where if we could I think it has to be a governing body. It has to be a reimbursement. It has to be coming up Medicare or some type of value-based care incentive. There's all these different variables to drive
Mm.
incentives in healthcare. And because we're not a universal health system, we're not like England, we're not like Canada or other universal systems. That it it hasn't worked in the past. So how do we create something that's almost like a meaningful use, but for data sharing, data collaboration
Mhm.
across the stakeholders, whether that be life sciences, whether that be
Yeah.
the providers, whether that be the payers, right? There's so many and this is a wand because there's no simple answer to this,
Yeah.
but I feel like it has to be something from the top down policy that connects all the stakeholders.
Sure. Yeah.
Because I'll give you the example of like prior authorizations.
Mm-hmm.
I mean, it's one of the most painful things in healthcare for all parties involved. And unfortunately, the patient suffers the most because the time to treatment can be heavily delayed. The providers often, uh, because they end up paying, or they have bad debt, they're not going to get reimbursed, but they believe it's the best thing for the patient. They're held up in the payer process and the approval of this specialty drug, and whether or not it's going to be covered. Um, so but if everybody kind of had the full longitudinal view
Mm.
of the patient record across the whole patient's life, like that's the holy grail, right? And then decisions could be made much quicker,
Yeah.
and
Yeah.
there wouldn't be this kind of all these bottlenecks that really prevent innovation,
Mm-hmm.
new treatment, research for new treatment and therapies,
Mm.
um, improved outcomes, and reduced costs.
Mm.
But
No, that makes a lot of sense.
but
Yeah.
it's like siloed data and different stakeholders, and not only stakeholders meaning personas like a health system or life sciences or payers,
Yeah.
but um, even within the systems, even within the own health systems,
Hmm.
from one EMR to the other, right? So Epic and an Oracle, Meditech. Think of Meditech still relevant because of HCA. Like there's still a big Meditech presence out there. Um, they there it creates these silos.
Mm.
So yeah, if I could
No,
say it, if
great.
I could say that in one sentence versus 10 minutes, it would be you know data, um, data access. Maybe it's even data democratization, it's transparency, collaboration, data collaboration.
Mm.
Um,
Mhm. Mhm.
yeah, all with the same goal of improved patient outcomes. Improved innovation, collaboration for new treatments and therapies.
Yeah, no, that's awesome, and I can see how that aligns to like the whole mission of MDClone, what you guys are doing as well. So it's really awesome, and I'll add a second one, maybe a follow up to that if you don't mind too. Totally get that side. How about actually on the sides that you are controlling, maybe the things that you are overseeing within the company. So the call it internally, if you had that one for how you guys are doing things as a business, the things that you are facing there as obstacles within MDClone, what would that one be?
That would be hmm, I'm gonna tie it back to the bigger picture, but
And it's
I
okay.
would
I'm
say
really
the immediate barrier, or like the biggest barrier, is really resources
mm,
and the evolution of like what's available. And I think what's happened is
mm,
you have a tech stack or you have a mix of data, you have data visualization, you have Power BI, you have analytics tool, you have what Epic has in for their analytics offering, you have what Microsoft's offering. Um, you have a lot of uh, analytics or data related solutions from
Hmm.
cloud to analysis to visualization. Um, and those have evolved, based on demand over time, and they kind of
Mm.
have their niche.
Yeah.
But people and systems have made investments in those. And then you have someone come in who says, well, we can complement all these. We can help you actually realize the value more instead of just finding out an insight. We're going to help you execute on it, and we're going to be held accountable. We're going to work together and partner in a collaborative way to prove out value.
Mm.
Um, and the hardest part is how do I buy that? What budget does that come from?
Mm.
I already spent millions on these other tools. Um, so it's a struggle from like an emerging solution or technology or innovative solution. That's,
Hmm.
I would say I've been thinking ahead for a long time, but it's not like the market just came out of nowhere. The demand came out of nowhere, right? So people have gotten in there and have serving their purpose, and we come in and need to help them. So the ability for folks to realize that even though you've invested in something doesn't necessarily mean that's the best or that there's not something better.
Yeah.
And that's kind of brutally, that's tough to say. I don't think I've ever said that to a prospect before. Because people, they, they make the case, right? They made the case a year ago for one tool or another that helped
Mm-hmm.
solve a problem and it aligns with their tech stack and it made sense, right?
Hmm.
So then to be on and say, but it just still doesn't help. You're not seeing the value. You're still not execute. You're still not seeing realizing the value,
Yeah.
right? You made your analytics department more efficient.
Yeah. Yeah. Yeah.
Okay, well that's really linear growth, right? Like you can hire more analysts and they can have this tool and maybe they can be a little more efficient and
Hmm.
your output can be a little more, but it's not this kind of hockey stick or this where you have now this flood of clinicians who are able to use an intuitive tool. Your analyst team can focus on the toughest problems, the toughest ones, but let's open the floodgates. Let's have it in a process and let's see. It's kind of like the innovation image where it's like, 100 post-its on one side of a funnel and you get 10 output. Well, think of like 10,000 on the left side and you get 1,000 on the right output, right? Like
Hmm.
there's just this volume.
Hmm.
Um, so helping them, if I could turn the key of, you know, here's how it can be different,
Mm.
right? And it's non-threatening,
Yeah,
right?
no,
So
no,
the
I
hardest,
like that. I
right?
like
It's
everything.
non-threatening. Like,
Even though you said like I've never said this to a process, I actually like how you framed that because it reminded me of and this might be a bad analogy, but I think it fits. Um, a lot of times, even when we're trying to just deepen our knowledge, upskill ourselves, you buy a book and then you're reading the book, and then the book is like really bad. You don't have to finish the book just because you have it there, and it's up to you, like it's something that you made an investment in doesn't mean it's the best thing for you to actually pursue, which is what kind of I think ties into what you said. Hey, you have these things, you have these texts, the stack, and all these phenomenal things, but doesn't mean that it has to be the best one. And just because you made that investment, it's okay to go on to the better boat that will actually get you to your destination
yeah.
as well.
And I mean, we struggle. We have these conversations internally all the time. How can our product integrate better so that it's not an all or nothing? Right? That's something that we're really focused on. So I'm excited to bring that to market and have more of those conversations where, hey, we're not, it's not an all or nothing,
Yeah, yeah, yeah.
right? Um, so we're trying to evolve our product to say, oh, you can plug in, you can have this Microsoft Fabric, you can manage your data and structure it these ways that you always have, and you can then put that into MDClone, and you can then create a synthetic data
Mhm.
lake without starting from scratch and redesigning and doing all this data architecture work. That's a lift for sure.
Amazing.
Yeah.
Good stuff. I know we're a little bit over time here, John, but I do have one final question for you here. And this question is actually not a question from me. It's a question from our last guest to you, and they had no idea who you were. So
Okay.
here's the question. You ready for it?
Yeah. Let's go.
What was the last challenge that you provided to one of your team members and were surprised by the results they produced when solving it?
Hmm. Um, so we touched on this briefly earlier, but
Yeah.
saying, hey, how can we utilize AI in our sales operations better? Right? I'm not asking us to go. I don't really have a ton of influence over our product development. I'm going to bring the market demands in, but what I do have a ton of influence on is how can we operate sales and marketing better.
Hmm.
Um, so I gave that to someone who's intimately close with those tools, and it said, I just kind of planted a seed of like, here's Lindy, right? Check this out. Are there other things like this, right? I can't dive into this, but this could be really neat.
Hmm.
And they came back with they really dove into it. This is just a culture in MDClone, like empower the folks, like
Mm.
maybe plant the seed and then see what they do with it, right? As long as they understand the problem we're trying to solve,
Yes.
then like let
Hmm.
them dive into it. So it came
Yeah.
back with pretty comprehensive overview of what Lindy was, and then are there kind of a competitive analysis, how it could maybe work, what's the next step to talking to them, how do we whether it's them or others, just this whole kind of project plan on how do we connect the dots better and improve sales operations. So
Awesome.
I don't know if that was
No,
like
that
a
is great.
problem.
Yeah. No,
Yeah.
that's great.
And
That ties into exactly into it. Yeah. Because then it's like, hey, you show them the thing, and then it's like, okay, now get your hands dirty. Like, show me what you can do with this information. And as you said, it goes back to the culture. If you have the culture where like, hey, they know what they're going to have to do, and even if they have to become more resourceful, go outside of their scope to figure things out, that person that you're bringing up right now, they did that, and that's exactly what we were looking for. So that's awesome, John.
yeah.
Thank you so much for your time. This has been such an incredible conversation. Where should people go if they want to learn a little bit more about you, and of course also a little bit more about MDClone?
Absolutely. So we're a global company, but I would point you to MDClone.com, and we have some country specific content out there. You can reach me through that. You can always reach me at john.elliott, first name dot last name at MDClone.com. We're fairly active in different industry engagements, different industry events. So we'll be at AMIA, which is more of that um, informaticist persona in academic medical centers. We'll be at American College of Emergency Physicians, where we really align well with emergency as far as like a specialty or service line. So we'll
Hmm.
be out there in Salt Lake in early September. You can always check us out on LinkedIn. Um, yeah, I was happy to have conversation and love for folks to reach out.
Amazing. I will leave everything down below here in the description if you're watching this and you want to check that out. And if you enjoyed this conversation and you want to hear more conversations like this, please hit the subscribe button and I will see you on the next episode. John, thank you so much again for your time.
Thanks so much.